The state of healthcare heading into 2024.
Welcome everyone to the state of healthcare heading into 2024. My name is TSCHALENKO and I'm a startup coach, pharma and healthcare expert and leading the digital health ecosystem at 5HT that I'm representing today, a global ecosystem for startups, corporates and investors. And together with our international experts, we will be discussing the future, especially next year. So please introduce yourself.
Yeah, hello everyone. My name is Dr. Jing OUYANG. I am a clinician by training. I trained as a doctor in the UK before then going on to found Patchwork Health. And we are a software as a service solution for workforce management in healthcare organizations.
Hello, good afternoon everybody. My name is Ravi RAMASWAMY. I'm the CEO of RV Consultants. Been in the industry for about 40 years, out of which I have spent about 30 years across 70 countries, understanding the dispensation of healthcare. Post to my superannuation, I now consult with global majors in terms of strategy and business development and setting up GCCs in India. Prior to that, I have worked for major companies like GE and Philips for pretty long extent of time. Thank you.
Thank you so much. So yeah, after 3 years of global pandemic and global warming and a lot of new technologies coming into healthcare, there is many challenges ahead of us. What, in your opinion, are the top 3 challenges for next year?
I think the biggest challenge in healthcare today, and it's been a challenge for quite some time, is that aging population and the services and the technologies to cater to a different profile of patient, coupled with the fact that there is a global shortage of clinicians and clinical skills. And I think it's the combination of this vicious circle, that is precipitating a lot of our kind of healthcare challenges today.
I think I would possibly add to what you said in terms of the challenges. The way that I look at it is there is a disparity in terms of the dispensation of care in the developing world and in the developed world. Cost, quality, and access and affordability of quality care is something that is plaguing the regions in the emerging markets, and therefore we need to come up with solutions that address this problem, these challenges, and at the same time be driven by technology as a backbone, because there is no other way we think we can circumvent this problem. Any amount of infrastructure funding is not really going to help us cross this divide.
Yeah, so you've already mentioned there's also a disparity in the different healthcare systems. So in your opinion, what do you think how can healthcare systems adapt to face those challenges next year and in the future as well?
I think the starting point, if we think about the disparities of healthcare that Ravi mentioned, it's about understanding the patient populations, right? I think it's probably intuitive to all of us in the audience that the healthcare challenges of a developed country like, say, the United Kingdom will be very different to that of sub-Saharan Africa. So healthcare systems, probably need to think through their first principles and their models of care delivery based on the populational needs, based on the population profile, and based on their own resources and cultural expectations as well, to put it in general terms.
I think if you really look at the healthcare industry, there are multiple changes that are happening. First one is basically empowerment. There is an appreciation that I need to take care of my health and nobody else can do that for me. For example, even my 90-year-old mother, who is now on WhatsApp with her sister who is 87, talking about their own problems and what they did and what medications they did. So that is one part. That realization is coming in. The second thing is the digital connect by which you have availability of care 24/7. The third one is value-based care that the government is reinforcing. The fourth one, if you really look, is on consolidation of IDNs. So I think there is also an ecosystem change that is happening, which is bringing in a lot more players from a point where the patient used to be an isolated individual struggling for services to a point where the entire system is going to be around the patient, and that is going to be a patient-centric situation. Possibly could be the North Star for us, but then that's where I think all of us are trying to do, which in turn boils down to the fact that you want to hit the quadrilateral aim that people talk about, saying, how do I enhance patient comfort? How do I enhance clinician comfort? How do I drive the cost lower? And how do I guarantee better outcomes? So I think that's the transformation that we are all in, and that's where I think technology is really helping. A long answer to a short question, Lisa.
No, that's great. Yeah, and as you're talking also about new technologies, my question would be, what in your opinion, how do these emergent technologies such as AI, generative AI, then also wearable technologies, telemedicine, will impact the patient outcome and healthcare delivery?
Well, I think they've got huge potential, right? And I think, we're already seeing powerful use cases through the use of, things like artificial intelligence. But actually, just taking a bit of a step back on that question, I think it's worth kind of appreciating where we are, as a healthcare, as healthcare systems. Before we start, really running with those kind of emerging technology concepts, we need to actually appreciate that many of the healthcare systems are struggling to adopt even, some of the well-established technologies that we have today that are available to consumers. As someone who has, founded a software as a service type business, we work with a number of hospitals to embed our technologies into these organizations. What you find is that, many of them are still using, software that is on-premise. They haven't even adopted the cloud yet. Many of the people who work in, these healthcare settings have been in, these organizations for, 24 years and are not used to many of the ideas that we talk about, that we're so au fait with at these kind of conferences. So I think, I guess it's a bit of a different question that I'm answering, but I think the starting point is actually reflecting on the maturity of many of these healthcare systems to even adopt the kind of technologies that are well established today. But going back to your question, I think that these emerging technologies have huge potential, as we're seeing in the consumer world, in the business world. But I think for healthcare specifically, there's going to need a lot more time to provide the reassurances that a healthcare system would need, and also to have the validation and the data behind it for these organizations to actually adopt. I think naturally healthcare providers and their clinicians are going to be risk adverse and suspicious, even if as innovators we're very optimistic to it.
I think you looked, it's beautiful. Let's look at the two sides of coin. You talked about the processes and the workflows out there, which need to be sort of modified with AI out there. The way that I would look at it is more on the technology side. Like, for example, if we go back the dates, if I had a problem with my liver, the first thing that I would do is to go and get an ultrasound done. Yes, it confirms the issue. I will go and get an MR or a CT done. And then I will do a biopsy if there is a lesion of sorts that needs to be ascertained. Once the biopsy is done, basically what I'm looking at is the cell structures. Now, technology will take it to the genomes. It will take it down to the RNAs, the basic microcomponents that actually form this entire synthetic biology. So the way that you're looking at an organ now is very different from the way that it was looked in the past. And here you are looking at an organ in a more holistic manner to see how you can address the disease state per se, which basically takes you to a point saying, how am I going to integrate the modality data that comes from various sources into a meaningful whole? One of my earlier panelists also talked about it. And I think that's where the industry is actually heading. And can I use AI as a wrapper to provide me meaningful information in terms of combining all these technologies and providing an outcome which basically helps the patient in sort of deciphering his disease and planning the next level of treatment for him. So, yeah, I think you might want to continue from there on.
Go ahead.
No, I also want to, I suppose, add, and I suppose answer the question also in a more positive manner. But I suppose, the big potential with these emerging technologies as well is the ability to allow clinicians to scale. Because as I mentioned, the biggest challenge that we face is that coupling of, an aging population with greater healthcare demands, but also a dwindling healthcare force as well, a global shortage of clinicians. So where I see technologies like AI playing a role is almost like, being that co-pilot, that augmentation to the clinician that allows them to be more efficient, to be able to draw more context, and to deliver that same human touch, but at scale. And you can see that potential in things like, telemedicine, where, there may not be the same kind of visual cues that you would get from a face-to-face consultation, but AI is able to, plug some of that gap. Or the ability for AI to essentially do some of the pre-diagnostic, do some of the workup, to then provide advice and suggestions to the clinician, but it's still on the clinician themselves to do that key diagnostic piece and, of course, apply that human touch.
In fact, I can give you certain concrete examples out here in terms of how AI has actually helped the dispensation of care, especially in the underserved segments. If I take the population of India, India is at 1.4 billion population today. 150 million people live in a city served by 520,000 doctors. And I have got 830 million people living in rural served by just 65,000 doctors. You go 50 kilometers outside of Bangalore and you will start wondering what medical care is all about. So in that circumstance, and for example, if I take a simple ECG, if I have a system by which I can take an ECG in a remote site, upload it to a server, be it on-prem, be it on a cloud, that is immaterial, where the server can actually do initial diagnosis and report out to you, and that feedback goes back to the physician, you are able to save lives there. And we found that in one of the studies that we did, about 40% of the people who walked into the clinic had some sort of heart ailment that needs to be looked into. So can AI do it? Absolutely yes, because now what you're trying to do is to decentralize care at a tertiary level or a quaternary level right down to a primary care. And that's something that the emerging world needs. I would also say here that when we marketed the first ultrasound machine, the value segment machine that we produced, there were two markets that we went after on the same day. One was India and the other one was Germany. So every country in the world has a profile of people which do need care at a remote level. And I think AI is possibly the best alternative out there.
Yeah, definitely. And I mean, me based in Germany, I can definitely agree on that you need technology, because getting an appointment at the doctor takes you months. And then we have the rural areas where there is just one doctor. But I think we're also talking about very different realities, right? So you are coming from India, and then there's much different realities than we have like in the UK or Germany. But nevertheless, we all can agree that there is much potential on that. Jing, you also touched the point on the culture and the processes in the healthcare systems. And for me, the question would be, what can healthcare providers, healthcare systems do to foster this innovation internally, this culture of innovation internally, but also with external partners?
Yeah, and I suppose in terms of my perspective on things, it comes from trying to bring an innovative solution to market and kind of navigating the challenges that that a healthcare system puts forward for innovators and entrepreneurs. I suppose and it was touched upon in previous panel discussions as well about creating that culture of innovation adoption. I think every organization, and speaking very much from experience, needs to have a couple of wins. They need to have had a positive experience with working with an innovative technology or with an entrepreneur that has then delivered them real value and allowed them to to deliver better care or to scale. So thinking about the experience of Patchwork Health, of which I've co-founded, when we created this business, we did it very much with the healthcare system. We actually co-created the original solution with an NHS hospital. And that was part of getting them to think in a more innovative manner. They were, they're obviously, optimized for care delivery. They're not there to, build technologies, but that was where our expertise came in. And through a collaboration of partnership in which, each side, provided their capabilities, we were able to develop something that was truly holistic and that met the needs of that organization. And on top of that, in the way that we started up, as it were, we already had the buy-in from the healthcare system. So fast forward a couple of years, the product is doing really well in that hospital. They also then encouraged their neighboring hospitals to adopt the technology. And also as an equity partner, they see the upside of the growth and the success of the business as well. And now when we look at that hospital, Chelsea Westminster, they are very forward thinking because they've had that win, and now they are much more appreciative of innovators that knock on their door and are more willing to take the risk as well. So it starts with some simple use cases, some simple wins, but ultimately some people who are willing to take the risk right from the get-go.
I think the way that I would look at it is to look at the market first, trying to understand what is the problem that you're actually trying to solve. Because once you start looking at that, then you realize saying that I come up with a clinically relevant innovation for that particular market. A lot of times I have seen taking the products which do not, like for example, the Western world products and trying to fit it in some of these underserved segments, they simply does not work. And there are reasons for it. Like for example, I'll give you a case where I had two teams, one working out of India and the other one working out of California. The problem was the same, saying how do I design a low-cost ECG? The way that the Indian team thought about was saying, hey, what do I do for power stability? In the monsoon, the voltage can range from 180 volts to 230 volts, whereas in the US, that's 110 volt is a fixed. People don't even think about it. If you look at bandwidth in India, you want to ensure that even at 512K, the system works. Whereas in the US, a 2 Mbps line is a given. So there are basic differences in philosophy in which the product ought to be designed. And that's the reason why you need to understand what is it that is relevant in the market out there so that you can build solutions suitable for that market. Else, oftentimes we have seen that a product that you try to force fit, it doesn't take you anywhere. And that's where innovation is all about.
Yeah, and just to add about that, in terms of the cultural change in organizations, I've seen that done really successfully at scale in the NHS. So the Clinician Entrepreneur Program has been, in my opinion, a huge success to change the mindset of many clinicians, administrators, managers in the healthcare system. And part of the goal of that is to get many of these people that work within the healthcare system to think about ideas and how to bring to market. But even if that doesn't happen, because entrepreneurship, the success rate is very low, these people are now familiar with innovations and are more amenable to some of those conversations from, other innovators as well. So that's been a really successful program that I've seen delivered at scale in the UK.
Thank you. So I want to look around in the audience if we have any questions to our panelists.
We're talking about older population, but there is a very dynamic population growing up, Generation Z, people who are born with the iPhones in their hands, and they have very, very different perspective on the health system, and they need to kind of be part of it. They need to be accommodated within the emerging technologies, and they actually can tell us a lot what they want. And I'm not really sure how much of development's happening in that space.
I mean, it's really interesting that you mention Gen Z and the emerging kind of generations, because I do think that a lot of the emphasis, a lot of the dialogue is around an aging population. But certainly, I've seen in terms of my generation and the generations below myself, there is a more openness, for example, in talking about mental health than ever before. And I think arguably some of our emerging technologies are also precipitating, mental health challenges. Having said that, though, the younger generation, as you mentioned, are more au fait with iPhones and with iPads and are more digitally native. So the way that they access care will likely be quite different. And I think healthcare systems and organizations will certainly need to adapt to that.
I would also add, like just a few years ago, I had many interviews with hospital providers who were saying why in healthcare we don't have, if we look at the flying industry and we can check in, we can do a world tour and we will know where we are in each step. And when you go to the hospital, you're super lost and you don't know what is happening. So the Gen Z and further generations will not get why it's so difficult to get like a streamlined process if I'm able to travel around the world.
Yeah, definitely, and also, many of Gen Z and below are going to become our future clinicians, right? And it does make me think about kind of my own startup journey. When I was a junior doctor, some of the technologies that we were using were so clunky, so outdated, especially the electronic patient record systems. I remember, coming into the ward and it taking about 10, 15 minutes just to boot up the system. Before I could do any work. I mean, that is just, lost time scaled across hundreds of clinicians. So, and I do think that certainly my generation and the generations below expect user experience like Uber, like Deliveroo. And that was some of the principles that we took into, building Patchwork Health, for example. Workforce management tools that, feel like what you would see in consumer. Like, marketplace solutions, for example. And that goes back to my point about, emerging technologies, where, we talk about AI, we talk about blockchain, but we need to also get some of the basics right, like electronic patient record systems that are, that can load up in like a minute, or, workflows that feel intuitive to end users, like the clinicians. And all of these things that if you can improve these, have a huge benefit in terms of hospital efficiency and probably clinical safety as well.
In fact, I would just add, the other day in Cleveland, we walk into an orthopedics office. The orthopedic speaks to my friend for 20 minutes. Okay, no EMR, nothing at all. And by the time he comes out to the reception, there's a complete printed system which talks about the diagnosis, the inferencing, the prescription, every damn thing. So by that, the doctor is able to spend a much, much larger time with the patient than ever before. Technology will push us there. The Gen Z will push us there. There's no doubt about it.
To finish this panel, I'll put one last question. If you could just give one piece of advice to healthcare innovators that are here in the conference, that are building new solutions, what would you give as an advice for the next year and upcoming years?
I think from my perspective, it's really understanding the system and the decision makers within that system. Often, we ride the optimism that one person can unlock it for us, but in reality, hospitals are enterprises, and you need to win over everybody, from the administrator all the way up to the CEO, from experience.
Two things: patient centricity and the world of autonomous reporting out.
Thank you so much. So thank you for being with us. And if you have any more questions, reach out to the panelists. We're here for you. Thank you.